Hi, it's Jim Tsaltas from the ISGE board. Welcome to the ISGE website. I'm very privileged and very honoured to have Professor Liselotte Mettler, a dear friend and really a pioneer in endoscopic surgery. Lilo, welcome to the ISGE website. Professor Mettler, we're here in Brazil at a fantastic endometriosis meeting run by our colleague Professor Abreu. One of the issues that was discussed today at the lectures that we were at was the need for early diagnosis of endometriosis. What are your thoughts in this area?
Well, I had the honor to be a student of Kurt Sem and dealt with endometriosis classification, I would say from 1970 on.
Yes.
We had developed called classification called EEC, Endoscopic Endometriosis Classification, which is a very good basic classification, but of course it does not help us to take all the aspects that we have nowadays into consideration for the treatment line of the patients. So I think we are really in a time, 2009, that we should incorporate the nice NCIAN classification of our Austrian group of Jörg Heckstein, and that we have worked on that, with other aspects into some listing or something that we can compare our data.
Yes. And I know that you've been involved with some work with Professor Abreu and his colleagues in trying to look at modifying the classification that we've been using. But with respect to our young patients, Professor Chapron mentioned today that the average time to diagnosis is between 9 to 12 years, and that many of these young patients will actually have symptoms in their adolescent years. How do we encourage these patients to present to their physician earlier?
We just have to listen to painful menstruations, because dysmenorrhea is an early symptom. And we have, for instance, made an up count. If you count a young girl, let's say from 17 years on till 45, she has pain for 5 days every month, for 12 months a year, for 25, 30 years. So she has 5 years of pain. And that has to be recognized, as Charles Chapron said, early, and we have to try treatment early.
Yes. And in these young women, do you feel, earlier on I was fortunate enough to be sitting in when Dr. Miller was being interviewed, and there are many more women who are going into the practice of obstetrics and gynecology. Do you think that that will allow our young female patients in the adolescent years to present? Do you think they'll feel more comfortable discussing these issues with our female gynecologists as opposed to coming to somebody of my age and a male?
That might be possible, and as I can see in Germany now in schools, we're being asked as female doctors to come and to talk to young kids, and many girls are coming later to these kind of lectures and present their pain they have at menstruation, what they can do, how they can diagnose it. And of course that is easy in the Western world, but very difficult in Arabic world, where they cannot be vaginally examined if they are virgins. So there the question is much more difficult, how to diagnose and how to help them. And I think we, in this conference also, we really compare all the strategies from the surgical side, from the immunological, hormonal side, and we hope to find some new pathways.
Yes. And you were talking about hormonal manipulation. For these young patients, particularly as you mentioned, I know that you do a lot of work and a lot of teaching in the Middle East. What do you think the first-line treatment can be to help some of these young women?
Well, at the present time, I don't think we have much else than hormonal treatment, and we can see if they are responsive to it. And of course, ultrasound, transabdominal with better quality, we can also see a lot. And as soon as we see that there is a good response, then we might have to subject them to laparoscopy early, and to just take some consequence of also surgical destruction if endometriosis is found.
Fantastic. And at the end of the day, it's about education, informing the patients. And Professor Mettler, thank you very much for coming along to the ISGE website, and I'm truly honoured and inspired by everything that you do. Thank you very much.
And I do hope the ISGE website is really going to everyone in the world.
Yes. Thank you.